Well, very good morning. Welcome back to Daybreak. Today is Wednesday and it's all about health and nutrition. Today, of course, we want to focus on health. Of course, it's health, fitness, and nutrition, but today we want to focus on health. Now, some interesting figures here. 1 in 2 people are currently living with diabetes. About 3.6% is the prevalence rate of diabetes. It is among the top 10 causes of death. And now here's another shocking thing is that most of those deaths that occur are for people who are under the age of 60. So if you want to learn more about it, we are here for you. I want to introduce my guest, Dr. Felix. Karibu sana.
Asante.
Uko sawa?
Niko ngangari.
Uko gangari.
Niko fiti.
Uko freshi.
Niko freshi.
Thank God that none of those gangari, freshi, all that have no political connotation. Otherwise, it will be another story. Diabetes is something that many people, in fact, there's even people who are living with it undiagnosed.
Sure.
It is one of those lifestyle diseases. And just to put it in perspective, of course, people, before we even get to, you know, type 1, type 2, is it that, you know, if you take too much sugar, you get diabetes? Are people born with diabetes? Like, what is the... Yes.
Okay. So diabetic is just inability of your body to secrete insulin, and insulin is an hormone that is produced by the organ in the body called the pancreas. Okay. So when your body is unable to produce insulin, which help in uptake of sugar in food called glucose. Now after digestion of food, the sugar in food or the energy in food is produced in form of glucose. So this glucose will go to your bloodstreams. So in your bloodstream after digestion, the glucose in your bloodstream need to move to your cell to give your cell energy. So it requires an hormone called insulin, which will be produced by an organ called the pancreas to attach to it and act as a key for the cell to take it in. So if the body is unable to produce insulin in the amount that is required to uptake the amount of sugar in your bloodstream, then this sugar will be in your cells, in your bloodstream in a high amount. Then this high blood sugar for a long time can lead now to diabetes, or the cells can still resist in uptake of the sugar. Right. So resistance or inability to produce insulin leads to diabetes. So one, it can be genetical. Okay, so in a family, if you have diabetes, history of diabetes, there are high chances that it can be genetical, it can be passed through genetics. Apart from that, there are medical conditions that can lead to diabetes that affect the pancreas, that affect the liver, or after complication after some procedures, or apart from that, hormonal issues that can lead to diabetes during pregnancy, and also medications such as steroids can lead to diabetes, several medication conditions, and apart from that, hormonal changes. But now diet and lifestyles also comes very far, and that's the question of you and sugar. Right. Remember, we have said that diabetes, how does the body control sugar, is by production of insulin to attach the glucose produced from food. So if you take more of the sugary food, like you say, there is something called the glycemic index. How long that the sugar takes in your bloodstream before it goes to your cells. So if you take foods that don't take a lot of time, go as quick as possible, then they raises the glycemic index. So meaning they also affect the insulin production, okay? Right. So over time, intake of the sugary food, yes, can lead you to diabetes because they will overwork your pancreas production of insulin over time. And as the body ages up, these organs also are overworked. And if there is that insufficiency production of insulin, then meaning only a little amount of sugar will go to your cells, but most of it will remain to your bloodstream and then can either also lead to resistance.
Right. Yes. And of course, we want to ask, welcome you to ask you questions. If you have any questions surrounding on diabetes, if you have some burning questions that you want answered, they can be answered here. So you can use the hashtag Daybreak, or you can SMS us on 22422. That number again is 22422. Send us an SMS and ask your question using the hashtag Daybreak, and we're going to be able to get some answers over here as well. So if it is brought about by sugar, because there's a lot of people who, first of all, there are a lot of people who are living with it and they don't know. So what are the signs and symptoms? How do you...
Okay, the signs and symptoms of diabetic depend on the sugar levels. So we have the normal sugar levels, and it differs generally among people. There are that normal sugar level for someone who is not diabetic.
Yes.
And we always say it's for someone who is not diabetic, the sugar level should range a bit from 4 to around 6 or 5.6 there.
Right. So you have to get tested to
yes, to know the sugar ranges through a glucometer.
Okay.
Yes.
Which is this one.
Which is this one, and the other different types of glucometers. Then apart from that, then I always tell my diabetic patient, if you're preventing diabetic, then monitor your blood sugar to be between 4 to around 7. Now, but if you're diabetes type 1, the sugar can be around from 4 to around 8.5. But if you're type 2, the sugar can be around from 4 to around 8. So in a normal circumstance of everyone, if you're monitoring your blood sugar or you're checking your sugar normal, almost always try and make sure the sugars are between 4 to 8. Now, if the sugars goes above 8, it means your blood sugar is high. If the sugar levels are below 4, means your sugar levels are low. And when below 4, you'll start having symptoms of low blood sugar. So what leads to low blood sugar? Now, when you have not taken food, let's say now you have irregular insulin production and uptake of sugar, not much sugar is going to your cells, or you have overworked yourself, your body has used energy. Or if you are a diabetic patient, you have taken medication earlier than food, maybe 1 hour before food or 2 hours before food, or you have taken a lower dose of your medication, or you have taken a small portion of food, this will lead to low blood sugar. Generally, if the blood sugar is low and we say it's the sugar that gives the body energy, you will be weak. So one symptoms of low blood sugar is general body weakness. Right. Now, when you are weak, what happens again when you are weak? Your organs won't have enough energy, and that's why even your heart don't have enough energy to beat and everything. So you can have faster palpitation or heartbeat. That can be there. Then apart from that, you can also have headache. And headache is normally due to sugar also support some general hormones that support the body. So headache can come in, and then dizziness can also come in low blood sugar. And apart from that, you can also have hunger. You're hungry, but that hunger is due to you have not taken food for some time. Right. Then dizziness can also come, and in a severe cases, you faint or you be in coma. That is low blood sugar. Now, high blood sugar can be you have taken too much sugary food or too much carbohydrate, or apart from that, you have not taken your medication, or you are not taking the right amount of medication, plus other causes. Right. Now, when you have high blood sugar, like I always say in a simple way, it's like putting salt in meat. If you put salt in meat, it draws the water in meat, right? So when the blood sugar is high, it draws water from your cells. So what happens when water is drawn from your cells? You become dehydrated. So what will you have? Frequent thirst comes in. And frequent thirst, because also your kidney is now not able to filtrate your system, you can also have faulty smell if it is a long term, okay? So frequent thirst, the water is drawn from your cells, and then the concentration of this water signals the body that it needs to remove the excess. What will happen? There will be frequent urination, okay? Right. So frequent thirst, frequent urination. Then there is frequent hunger, because most people who are diabetic and the sugar levels are high, even after eating 10 minutes, you feel hungry. The reason why you feel hungry, yes, the sugar is secreted from the food, but it's not going to your cells. So the brain is signal, I've not gotten everything. So frequent hunger comes in, frequent urination, frequent thirst. Then there is blood division also can come in. Because this sugar goes through your nerves, and it can irritate the nerves of your eye. And then they fail to adjust to light or to image and everything. So that irritation, you can also have blood division. And apart from that, there is also, we have issues of hormonal changes that occur, and this can make someone to be fragile, or you become excessive hunger. You're very hungry. Yes, you're very hungry because of hormonal changes, among several others that can happen when the blood sugar is high.
So one would ask, because some of these symptoms is what you could get when it's just something else. So how would I know that this headache, it looks like I need to get it checked further, or is it just a normal hangover headache?
Yes, headache can happen due to several things. Yes. And we say both low blood sugar and high blood sugar actually have the same symptoms of an headache. Right. So headache can be low due to low iron levels. Headache can be due to high blood pressure. Headache can be due to low blood sugar, or even stress and other issues, even irregularity, or when your electrolyte levels are not balanced, you can also have headache, among other issues. So the best thing, if you have headache, if you have frequent thirst over time, you have dizziness over time, or you see there is frequent urination, you didn't used to urinate oftenly, but there is frequent urination, or if you have drastic weight loss, because if you also have high blood sugar, it leads to drastic weight loss. The reason is the energy is within your cells, within your bloodstream, the cells are not getting it, so the body will burn up the fat and the protein in the muscles for energy, so you have frequent weight loss. So if you have any of that, the best thing, don't guess if you're diabetes or anything. And that's why I say regular checkup in an hospital is very important, because if you go for regular checkup, they will always do your sugar levels. And if the sugar levels are above normal, let's say they're above the 8 that we have said, then they will say, okay, you need to come more often. Now every week we monitor your blood sugar level. So if they see it is higher than normal, is always 8, 9, 10, 11, then they can do a diabetic checkup. Now remember, this only measures this plasma sugar level, the sugar levels in your blood. So sometimes
this one, right?
the glucometers or the other machines in the hospital.
Glucometer where you attach
yes, the blood. Yeah. I'll show you how we'll do it. We'll do it practically later.
Oh.
Yes, on myself, not on you. It's not painful. Yeah. Now, yes.
Yes, okay.
So we have different tests that can be done to confirm that one is either diabetes or not.
Yes.
And one is called Hb1c test.
Hb1c.
Hb1c. Okay. This is a test done on your cells to check averagely how they have been taking sugar for the last 3 months. So it's an average of your blood sugar level within yourself for the last 3 months. So if the average becomes above 6.5 or 7.5, then you are determined to be diabetic. So
is this done at once or over that 3 months?
No, just if you do it at once, it will measure it.
Okay.
It will do the average on itself.
Okay.
So if the average comes 7.5% or above 7%, you will be considered diabetic. But there is another test also called oral glucose tolerance test. That is whereby you'll be given a high sugar molecule to ingest in your body. Mostly, in some cases, they use a glucose, the normal glucose.
The powder one.
Yes, yes.
Okay.
So they'll give you that in a specific dose calculation, and then monitor your sugar within 30 minutes or even within an hour and 2 hours. So if that sugar levels, there is a ranges that it should be between an hour and after 2 hours. But if it is above 8 and everything, they will consider you to be diabetes. So they can either do both of them or one of them. Yes, and then monitor you over time.
Right.
So then after that, as to being considered your diabetes, then you'll be managed according to your sugar levels.
Right.
Yes.
And then now they are different, because we hear type 1, type 2.
Yes, yes.
What are they? And also just a reminder of the question, if you have any questions,
yes,
we invite you to ask them. If you had any question around diabetes, you can ask them today and get some answers and some help as well. Okay. So, again, we hear type 1, type 2.
Okay,
explain to us.
So once you have diabetes have different types. So you have type 1 and type 2 diabetes. So type 1 is called insulin dependence diabetic mellitus. Okay. And mostly these are people who have insulin resistance, or the pancreas secretes very low amount of insulin, or it doesn't secrete at all. So if the pancreas doesn't secrete insulin, or it secretes a little amount of it, so meaning that sugar will not go to the cells, because we say it's insulin that takes sugar into the cells. So why is it called insulin dependence? Because you will be dependent on insulin injection. So for diabetic type 1, they have to be injected with insulin, because there is resistance completely of insulin production. There is no insulin production completely, or insufficient amount. Then we have type 2 diabetic. And type 2 diabetic normally is whereby the pancreas secretes insulin, but the cells are resistant to it actually, and not able to uptake it sufficiently as required. So mostly type 2 is the lifestyle diabetes, happen to people above 35 years and above. Type 1, sometimes in children or in the genetics, the one we said. Then we also have a type of diabetes that come due to hormonal changes during pregnancy. It's called gestational diabetes. So the hormonal changes during pregnancy of a woman when they are pregnant can alter insulin production or uptake in the cells and lead to high blood sugar levels that can lead to gestational diabetes. But this is a type of diabetes, if the sugar levels are not higher than normal, then just diet is able to control it. Then after delivery, it disappears. But if it is higher than normal, the sugar levels are higher than normal, then they will be given medication depending on the sugar levels. But it normally, if well monitored, it disappears. But for type 1, you'll have to be dependent on insulin.
Right.
For type 2, you can use oral medication if the sugar levels are not high, but if the sugar levels are higher, let's say than 15 of the HbA1c or 20, then you can be started on also insulin dose, or the doctor can use both of them. Right. Yes.
So those are, you know, and as you can see, the question is up there. If you have any questions, you can go ahead and ask any question around diabetes. SMS is 22422, hashtag is Daybreak. Now, so we have people who manage diabetes differently. But before we get into that, what are some of the, does it come with other complications? Because
yes,
that's what people are normally afraid of.
It does.
That hata sitaki kuwa tested because sasa ndajua hii iko linked na hii, you know, what you don't know doesn't harm you, sort of thing, which is wrong. But what are some of the complications that come with diabetes?
With diabetes. Now, diabetes can also be brought by different complications. When one has 2 or 3 complications, they can have diabetes. Like we were saying, when you have COVID, there are high chances of you getting diabetes, and one is due to the medication that you're being, the steroids. Or if you have diabetes, also chances of managing other complications becomes difficult. So there are complications that comes with diabetes. And one we have said, when the sugar levels are high, they go through your blood vessels in a simple way, right? Through your arteries. So when they go over time, it's like the acidic nature. When you put an acid in something, it corrodes it, right? So they will irritate your nerves over time, and you'll have something called neuropathy, whereby the neurons or the nerves are affected. And if affected this for so long, they can start clogging. You can have blood clots, maybe, and then that insufficient flow of blood can lead to dying of the cells around that area, and that can also lead to a diabetic wound, okay? Whereby unaambiwa unaenda kukatwa mguu or mkono, something of that sort. Yes. Apart from that, apart from the diabetic neuropathy, we also have something called diabetic retinopathy. And we said high sugar levels also irritate the nerves of your eyes. So it will cut these nerves over time and lead to protein leakage. And this will lead to dying of the cells of your eye that can affect your eye. And that's why we advise every diabetic patient at least go for once a year eye checkup. So that they check if your eyes have a problem, they tend to correct it, okay? Then apart from that, we have something called diabetes nephropathy. That is a problem with your kidneys because they irritate your blood vessels. Also, the vessels or the nerves of your kidney are irritated, and if they're irritated, they fail to filtrate the blood and water and toxins as required, and this can lead to kidney disease. So diabetic neuropathy of the nerves, retinopathy of the eyes, nephropathy of the kidneys. Apart from that, we also have the gum issues, okay, the gum and teeth issues that can come with diabetes. Heart issues can also come with diabetes because that irregular blood flow will also affect your heartbeat and can lead to heart diseases, okay? Apart from that, there is erectile dysfunction in male because it also tends to interfere with your penile arteries in supply of the blood for you to achieve the erection. So there are so many complications that can come with diabetes, the kidney disease, the heart disease, and so many more. Yes.
So those are quite heavy ones as well. So I guess if somebody is watching and they have been diagnosed or know somebody who has been diagnosed and they have type 1 or type 2 diabetes, what then, is there a different way of managing both of them, or how is it done?
The management of diabetic is depending on the sugar levels and the type of diabetes. The management differs between the type of diabetes and the sugar levels. But one common management is if you have diabetes is either by you have resistance of insulin uptake or you have inability to produce insulin. So one is medication. So that the medication goes, if you have, the pancreas is still functional, producing insulin but not enough, the medication to go to the pancreas and help in producing enough insulin. And if you have inability to produce insulin, then you'll be given insulin from the outer source. So the management on medication is either on insulin or oral medication.
So insulin is on you
inject. This is one type of insulin. Okay. This is now Insulin Pen. What is inside here is an insulin. It's always liquidic in nature, but the color differs with different type of insulin.
You just
Inject. I'll show you how to do it later on.
Okay.
Now, insulin mostly is a starter dose for anyone who is type 1 diabetes. You'll be given insulin. So type 1, they don't use oral medication.
Okay.
They use insulin. But type 2...
So what would be like this one?
Yes, like this one. Or many from other companies also, they have different types of pens, okay? Now, type 1, they will be given insulin injection. No oral medication. But type 2, you can be started with the oral medication if the sugar level are not that higher than, let's say, 10 or 11 or 12. But if the sugar levels are around 20, you've just gone to the hospital, you didn't know you were diabetic, because people walk with diabetes, and as you have said, 1 or 2 people have diabetes, and 3 or 4 also have diabetes. And in Kenya, we at 3.6% of our population have diabetes, and this number is to rise to about 4.5% by 2040. In Africa, we're about 9.3%. In the world, 436 million people have diabetes. So check it out. How much do we use in Kenya for diabetic? In every household uses about 18,000 per month for diabetes.
The ones that have...
Yes.
And that have diagnosed.
Yes. In Kenya, the government uses about 20 million shillings a month. In the world, we use about 79 billion shillings for diabetes. Okay? So if you have diabetes, type 1, we say insulin management. Type 2, oral medication, depending on the sugar level. But even type 2, you can be given insulin. So there are cases where people say, oh, me stuck insulin, I don't want insulin. It's given people when things are worse. No. Insulin, when the sugar levels are high, that the medications, oral medication can't control, then you can be given a lower dose of insulin, depending on your sugar levels, to tend to take what is excess that is remaining in the bloodstream, so that you doesn't lead you to the complication. Because what will lead you to complication is the high blood sugar. Because the complication of low blood sugar is either coma. It's coma, you faint, and coma and shutting down of your organs, and we can lose you. So low blood sugar complication is there and there, but high blood sugar is over time.
Right.
So once you are on oral medication or insulin, remember, this medication are only helping uptake of sugar. But where is this sugar coming from? Is the diet. So I would say government should start employing more nutritionists, because it's the nutritionists who will tend to educate the public to prevent diabetic, to educate the public how to manage sugars. And in fact, patients should stay more time with the nutritionist than the doctor, because there is no specific dosage of diabetic medication. It's given according to sugar level. So what if I'm diabetic but sugar levels are normal? Will the doctor give me medication? No, he'll just tell me, go monitor your sugars. But who will help you is the nutritionist. So that plays an important role, because this is where the sugar comes from, the carbohydrate. Then we have exercise. Now, to help in circulation, blood, and open yourself for uptake. So management of diabetic are 3 things: medication, diet, and exercise. Yes.
Medication, diet, and exercise. We want to hold there. There's some questions that are coming in on our SMS. We want to try to get as many of them as possible. We have some here. Let's take a look at them. Somebody says here, if you get diabetes at the age of 50 years, can it be healed or cured?
Okay. Nowadays, there are analogies, or people say we are reversing diabetes, right? But I always tell people, yes, you can reverse diabetes, but what are you going to reverse is just the sugar levels. So diabetes, you can't say I've cured it completely, but you can say I've managed my sugar levels within the normal ranges for even a lifestyle. But you can't cure it, because there is already problem with the pancreas. It can't go back to normal, right? So you can't cure. Yes, you can manage diabetes, but you can't cure diabetes. So when the sugar levels are within the normal ranges, you are as normal as any person. So basically,
I guess what you're saying is, if you're able to just manage it well, reduce sugar, do what is necessary.
Yes, and that's why I always say it's good to work with your nutritionist, because we have said what makes the sugar levels high is the high glucose levels. So type 1, you can't cure it, because that one we said you need insulin. There is no way you'll go out of insulin. all right? So that one you have to use medication, you can't go out of medication. But type 2, we can manage at a point whereby you reach, you are not using your medication. But the most important thing, even if you're not using your medication, is having a glucometer. So that today you are given medication, you have also practiced your diet as you are told, and the sugar levels are now within the normal range. So what you'll be doing is oftenly checking your blood sugar, so that, yes, I always advise my clients, if your first week of diagnosis, you're firstly diagnosed, you're a new diabetic client or patient, the first thing you need to do is monitor your sugars at least consecutively for 2 or 3 weeks, because this will tend to let you know how the sugars are and how different types of food raises your sugar. And over time you can do it either once a week or twice a week generally. Yes, but if you are not using medication, you have known that your sugars are normal, then you can do as often as possible, even daily, because you're not using medication. So that if the sugar levels go high, then you go back to your medication. But if you're normal, you still control on diet and lifestyle. All right,
right, we'll go to the next question. We have a viewer said, can diabetes lead to a stroke?
Yes, it can lead to stroke, and like we said, it leads to what we say the neuropathy, the problem of your nerves. And if the nerves are affected, there is no blood circulation, right? And the blood clot also happen that hinder your normal blood circulation. And what will happen? Low blood will also flow to your brain, and the brain needs oxygen to function. So if the less blood goes to your brain, and if the brain is not able to get enough oxygen, the brain cells will start to die. And if the brain cells start to die, they'll fail to coordinate the body, so it can lead to stroke.
All right.
Yes.
Mafimbo from Kwale County says, is diabetes inherited? I think we answered that one.
Yes.
You can get it, it's genetic. Johnson says, I'm diabetic. What's with the sensitiveness with the feet in connection with the diabetes?
Yes, the sensitiveness with the feet is what we have said is the neuropathy.
Okay.
So
the nerves.
Yes, the nerves. So if there is no sufficient blood flow, even not a much blood flow will go to your legs. So when there is no much blood flow to your legs, the cells of your legs tend to die, and that's why you don't have feelings on your legs. And that's why I always also advise diabetic patients go for foot checkup once every year, and every night tend to wash your food. And when you wash, try to feel it if you're having sensation. So when you feel you are starting to lose your sensitivity, then it's important to go be checked up as immediate as possible,
right? Because
that can lead to diabetic foot and amputation.
Right.
Yes.
I will be able to get to that, Justin. What are the foods to avoid?
Okay. Yes. Now, I will say that is much on diet and diabetes.
Okay.
So previously we used to have a specific diet for diabetic patient, and that is due to lack of much understanding on diet and diabetes and everything. But nowadays we say there is no specific food for a diabetic patient. Okay. So a diabetic patient can enjoy the foods that a normal person takes. But one thing that you know, there is a problem with sugar uptake, right? So you should avoid anything with the high sugar content.
Right.
The normal sugar, the sodas, the juices, the cakes, anything with sugar, kick it out. Now, as per the carbohydrate is the source of energy, right, which is the source of glucose, and carbohydrate we say is ugali, chapati, we have the yams, we have the bread, we have the uji, we have the rice, and all the rest. So avoid the simple ones, avoid the deep fried food, avoid the cakes.
So the simple carbs.
Yes, the simple carbs. Yes, the sodas. Thank you very much. So avoid the simple carbohydrates and lean more on the complex carbohydrate. The complex carbohydrate means they take time to be digested. So meaning the sugar release will be slower. So they won't affect the insulin production and overworking the pancreas. The body will be able to uptake. The simple carbohydrates are digested faster and they affect your sugar levels that will lead to high blood sugar. So avoid the simple ones. Now in food, like I always say, tell my clients, we always say take more of the brown food. Yes, the reason why we say take more of the brown food because of something called glycemic index, which is how the body produces that sugar levels. Okay, so the faster the sugar levels are produced, the faster they will affect the sugar level. So take those whole grains with the lower glycemic index, which are the whole grains, the brown ones. But the carbohydrate content in a glass of brown rice and a glass of white rice is the same. So they will raise the sugar levels the same way. Okay, like we always say, 10 grams of carbohydrate. Okay, 10 grams of carbohydrate is like roughly half a slice of bread. Okay?
Half a slice.
Roughly half a slice to 3/4 is 10 grams carbohydrate. Or roughly half a cup of rice or 1 serving spoon of rice is roughly 10 grams. Or roughly half a fist size ugali, or half a fist size ndoma, or half a fist size sweet potato, or a half a cup uji, or a half a chapati, or 1 medium fruit, let's say orange or apple, is roughly 10 grams carbohydrates. So 10 grams carbohydrate is able to raise sugar levels by 2 to 3 units. Okay, so meaning if you are to take 1 slice of bread, be it brown or white, the only difference will be the rate of sugar release, but at the end of the day they'll have the same amount of the sugar because they have the same amount of carbohydrate. Otherwise, shamba ya mchele, si kuna pandwa brown rice. Rice is rice. Rice is rice. Yes, the only difference, yes, rice is rice. The only difference is on milling. Yes. So the brown one, they don't remove the chaff. The white one, they remove the chaff. So the same level of carbohydrate, the only difference is the digestion rate because of the fiber levels. Okay. So I always tell my patient, the portion becomes important. And it's the portion where the nutritionist now will guide you depending on your sugar level and even your dosage of medication, because there is also how the carbohydrate and insulin dosage should be calculated. So that will put for you a diet plan depending on your carbohydrate levels. And we always say, if you are diabetic, your carbohydrate content within the day should not go above 130 grams per day to 260 carbohydrate total. Then apart from that, we'll balance your portion so that whatever after digestion will not produce sugar beyond 8 or below 4, so that we monitor you that food you should take it after, you should take food after every 4 hours. For diabetic patients, small frequent food, but we make your portions okay. Yes. Yes. All right. This viewer is asking. My question is about fruits. When you have diabetes, how much fruit should I take? Should I also do away with the carbohydrates completely? The same thing that I talked of carbohydrate and sugar levels. We say 10 grams of carbohydrates raises blood sugar by 2 units. So what will differ is just how fast do they release, similar to fruits. So fruits raises sugar levels because fruits have sugar called fructose. So 1 orange can raise blood sugar by 2 units. Okay. When you say one, that is one normal orange. 1 apple can raise blood sugar by 2 units. But 1 ripe banana can raise blood sugar by roughly 4 or 6 units. 1 mango can also raise blood sugar by, half a mango is around 4 units of sugar. So 1 full mango is about 8 units. So if you are to take a full mango, a cup of tea, milk also have some sugars. So half a cup of tea, half a cup of milk, of yogurt, plain yogurt or mala, can raise blood sugar by 2 units. So an African tea, you get half a cup is water, and half is milk. So a cup of a cup of African tea without sugar, because of the lactose, raises blood sugar by roughly 2 units. So if you take a cup of tea, you know that is 2 units. 1 slice of bread, we say it is 2 units. 2 units. So if you are taking tea and bread, ripe banana. Yes, if you are taking tea and bread, do not pass 2 slices of bread. Better brown so that it reduces your production of sugar levels. And so if you take 2 is 4 units. A cup of tea will be 2 units, that is 6. You are still within 4 and 8. So if you are to add anything, you'll only add something with the 2 units. So if it is apple, you just take 1 apple. If it's orange, just 1 orange. Fruits that tend to raise blood sugar so much are ripe banana, watermelon, and mango. These are fruits that you look up to. When your blood sugars are high, avoid them during your breakfast or lunch, but you can take them as a snack, but not more than a slice of 20 shillings watermelon, not more than a slice of pawpaw of 20 shillings, not more than a quarter slice avocado, not more than 1 slice pineapple, but only if you know your sugar levels are within their normal range. So I guess that's why you're saying you have to eat small frequent meals. Yes. Because then ukichapa mtu hapo na 2 slices. Yes. Peke wake. Hatasikia njaa sana. Yes. So that means every 4 hours you eat something. You're eating something. So you'll be okay. Yes. So we can take 2 slices of bread, a boiled egg, and a cup of tea. A boiled egg is just 2 units of sugar. The rate of release of the sugar will be different, but it's roughly 2 units because of the level of carbohydrate. So plus 2 units of tea, that is 4. Plus 4 of 2 slices of bread, that is 8. If it is ndoma, a fish size, a potato, a fish size, do not take uji and bread. Do not take uji and ndoma. They are the same classes of food. They will raise your blood sugar. But you can take uji and a boiled egg, or uji and 2 servings in protein, or uji as a snack. So we'll tend to balance these foods and fruits because they can raise your blood sugar levels. Yes. This question, I think we answered it in terms of the beginning, but the difference between diabetes mellitus and diabetes insipidus. Did I pronounce it rightly? Yes. Yes. Mellitus mostly is whereby there is the insulin irregularity or production, but the insipidus is whereby also there is the resistance of insulin production. So almost all of them are just diabetes, like saying pre-diabetes when the sugar levels are higher than normal. So generally the management depends just on the sugar levels. Okay. Yes, yes.
All right. So yeah, what causes diabetes in babies below 1 year? Because you mentioned that babies can...
Yes. So babies below 1 year, yes, they can get diabetes. And one of them is the genetical factor. Okay. But there is also when a mother has gestational diabetic during pregnancy, there are higher chances that the baby can also be born diabetes. There is also the immune issues and genetical issues, or the poor pancreas formation during pregnancy due to lack of 1 or 2 nutrients. So genetic can play a role. Also, the preterm babies, they are born when not all organs are stable. Several issues can lead to that. Yeah. Yes.
All right. Can diabetes cause infertility?
Yes, we said it can cause infertility, and due to the reason we said it affects the nerve. So in the male organ, we have something called the penile arteries. So when there is high blood flow, or when the nerves are affected, it can irritate those nerves and lead to irregular blood flow to the penile arteries that lead to erection that affect your fertilities. And even to women, it can imbalance other hormones that can also lead to infertility.
All right, so I tell you what, it's quite something. Well, let's go into the demonstration here. I see there's a chart with blue, green. What's going on over here? So
normally this just tends to show where you should inject your insulin and how you should inject your insulin. Because one of the problems with management of diabetic is the medication part. So I always advise my diabetic clients, do not stop your medication unless you are advised by your doctor. And use the same dosage of medication that the doctor has told you to use.
Yeah, so don't
go overboard unless the doctor says. Because if you go
so what if you miss, like...
If you miss, meaning the sugar levels won't be uptaken as required, so there will be regular sugar uptake that can lead to high blood sugar. Okay?
Like if you miss, I don't know how serious it is for missing an injection. Maybe you can also answer that. Like what happens if
let's say in the morning your sugar levels were 10, right? And then you injected yourself. And then you didn't check yourself, and maybe the sugar levels are at 15, and you have missed your injection. It will lead to irregular diabetic monitoring and management, because this medication is to take you for some time. So when you miss, then you won't be managed as required, because it will affect your diabetic management. Yes. So irregular sugar levels can occur. Okay. Yes. All right. So insulin can be injected, one, on the arms, okay? We have on the thighs, and then we also have, some people also do it on the buttocks, okay? And also on the stomach. But I always tell my clients the best place to inject, if you are injecting on your own, is the stomach, because it's easier to access and it has larger surface area and is not closer to muscles as possible. But on the arms, you can be only injected when someone else is doing it for you. Yeah. And then on the thighs, you see the surface area and is closer to muscles, and due to movement and anything, chances of something called atrophy, where the nerves tend to be wounded in a way, can easily happen. So I always say the best place to inject is on the tummy. And on the tummy, like you can see my diagram, if you can see my diagram, you can put it just, you should inject, you see, if this is your how do we call it?
Belly button.
The belly button. It should be at least 2 inches away. This side all is just to inject.
Oh, and sort of like that also there.
Yes, on the screen. Yes, on the screen. Yeah. So it should be 2 inches away. So like you see my diagram, why is it divided in different colors or different spaces? Because to avoid injecting the same place every now and then. Because if you inject the same place every now and then, those cells tend to die, and the uptake of your insulin will be impaired, and you can also affect those nerves. And that's why it's good to rotate. So in rotating, you just take 2 centimeters away, then you can divide it into segment, either by you divide it into quadrant. So this upper part, lower part, upper part, lower part. So the first day you can inject this place, you can count 1, 2, 3, 4. So 1, the first day in the morning, in the evening, then the next day in the morning, in the evening, then you rotate that way. When you're finished with this part, you come to that part, and then you come to this part. The way this diagram illustrates, but is on the thighs, you also do the same. You can still rotate. But the problem with insulin injection is...
So this helps, like, do on a tour?
Now, if you have this, we always give this freely to our clients in the hospital to teach them for the first week. So by then, they will tend to know which part to inject. But if you don't have this illustration, just know that this side of your stomach is all for you to inject. This side is all yours to inject. So you can inject here in the morning and this side in the evening. The next place you rotate to prevent those cells from being affected and those nerves. Yes. Okay. So rotate, that is important for you for uptake of insulin.
Right.
Now the other thing is the problem with diabetic patient, you are given, yes, the doctor has prescribed for you insulin, but you inject, yet there is no insulin going into your cells. So every time your sugars are not normalizing because you are injecting here. There is nothing you're injecting.
Right.
So knowing proper way of injection is very much important.
Yes.
Or you are injecting, but you remove it so quick, there is spillage of insulin. And even a drop is a dosage of unit of insulin that is supposed to monitor your blood sugar.
Yes.
So knowing how to inject properly is important. So we have different, when this is an insulin, a type of insulin pen. So insulin normally comes when they're just pens. Okay? But they also have needles. So there are different types of needles. This is a used one. I'm just using as a demonstration. There are different types of needles, and needles differ depending on the millimeters. So the normal needles that are supposed to be used for injection are 6 millimeters and 4 millimeters. Okay. So 6 millimeters.
Is there a difference in
the size? The size.
Is it pain?
Yes, the pain.
Yes.
The 6 millimeters will be more painful.
Okay.
But that is, depending on different companies, that is how they make them easier to use. And the technique of injection of insulin also matters, because there are those that have springs that just go pop, and those that also tremble in a way. So when the springs between trembles, then they will cause pain and can cause also irritation of that part of injection. Okay. So it depends on the technique of the insulin pen makeup and the needle. Right. So normally for syringe needles, we use 6 millimeters. But most insulin pen, we advise 4 millimeters because it's comfortable and it doesn't go inside the skin to the nerves. So insulin should be injected in something we call subcutaneous. So on top of the skin, not intramuscular in the muscle. Okay. So if you have a 6 millimeter needle, the longer needle, then it's advisable before you inject all your skin. But this little one you can just inject. So before you just put your needle. After putting your needle, in most cases, insulin have ranges in units, okay? They're roughly 300 units. Okay. So this will last you depending on what the doctor's prescription. So normally, the doctor will tell you amount to inject, let's say 14 units, right? Or 10 units in the morning, or even either 8 in the evening. So if the doctor says 10 units, then you'll rotate this.
Oh, you might not lift it a bit high.
Yes, you rotate this. So if you see, make sure it's at 0 the first thing. Right. Okay, then rotate it up to 10. Okay. If I'm rotating, you can hear a clicking sound. Yes. That is to help those who are diabetes, who are blind or have eyesight issues, so they can just listen to the sound.
They can count.
Yes. So just 1. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we are 10 units. Right. Now the best thing is, before you inject your insulin, tend to just put it above with a unit, so that you check if it is removing insulin. Sorry for using your table. So how do you inject? You just press on this top upper part. Okay. So I'll just press just a unit. You see there is a bit of spillage, drop, right? Yes. There is a drop. So once there is a drop, if you pass your new unit, you just go back to it. Then now what do? You are ready for injection. So how you hold your insulin also matters, because pen, so that you see the reading until they are at 0. So I'm going to use a dummy. Sorry for taking your time. No. I'm going to use a dummy. Let's say this is my tummy, and we said 2 inches away, right? Right. Allow me to use it. Sorry. So if this is my tummy, this is 2 inches away, right? So this is my tummy. So if I'm to inject my insulin, make sure you hold it upright, 90 degrees, because if you put this this way, it might not be in the level skill where is required.
Okay.
So make sure it's at 90 degrees, you're able to see, then inject yourself, okay? So once you inject yourself, then you'll release. So once you push the insulin, the upper part, then it will just rotate up to 0, okay? So once it has 0 and you can see it's at 0, do not remove it immediately. Count for 2 seconds. Maybe you can just count 1, 2, 3, up to 10. To avoid spillage, because if you remove immediately, there will be spillage, and you can see there is a bit of spillage. So wait so that you have the exact units of the insulin that the doctor prescribed. Then after that, you can remove. Now, about the needles, it's advised that once you're done with your needles, you should dispose it. But now, if you have challenges of finance or buying them, it's not advisable to reuse, because it becomes bland and it will be painful for you. And it can affect your nerves. That's why we say it's not good to reuse the needles. So you should dispose them where also the children will not attach.
Yes.
Yes, that is very important. So after disposal, the insulin that you are already using, you can just store it even in your pocket. If you're going to inject yourself at lunchtime, you can just store it to use it later on. In your pocket is a pen, so that you inject yourself again later on. Right. But the ones you are not using, if you have a refrigerator, you can store them in refrigerator about 15 to 25 degrees, or pale inje.
Yes, yes.
Inje ya mlango, not ndani. Yes, sindani. But if you don't have a fridge, let's say you are at home, then we tend to advise you, let it be at a cool place as possible, but at least it can stay up to a month if it's between 15 to 25 degrees.
Right.
Or you make a sufuria, okay, and you put water, a bigger sufuria, you put water and then a smaller one on top. Or you can also, what you can do, some people also put in cotton and spirit, because it attracts hair, and spirit is cold, so it gives that coldness nature. But we'll always advise you to keep them.
Yes.
Yes. Now, the cold one in the fridge, you can remove it earlier, or what you do before now you use it, because it's cold, you have to give it some heat. So you can rotate, you can rub it on your fingers like 10 times, 1, 2, up to 10. Then you can also mix it up, because it was clogged a bit. You can mix it up 10 and again 10, and then you put your needle and you see it's coming out. That is how you inject your insulin.
Right.
But the best way, the doctor mostly tend to advise, inject your insulin immediately after your meals to prevent low blood sugar. But ideally, the insulin that should be injected 30 minutes before meals. But the problem with Kenyans, you want a day at a time. So you'll inject and then you forget you are to eat, you go and the sugar levels go low. So be very cautious when you're monitoring your blood sugar and when you're using your insulin.
Right.
Yes.
All right. I don't know if we have time to show this. I know we are out of time to show how it works.
It's okay. It's the same thing that can be monitored, so there is no need.
You can put it in. And
yes, and then you withdraw blood. So the different types of machine, there are different types of machine in the market, and that's why I would really feel the government should have restriction on the machine that come to the market, because Kenya has become a dumping site. So even machine that doesn't have ISO qualification or ISO satisfaction are in the market, and they don't give us the normal blood sugar levels that are required. So mostly get the machines that have latest ISO, then machines that the difference is normally in the strips. Now the best strips are strips which have something called glucose dehydrogenase.
We're being told you can show us very briefly how it works, just so that we have that. So
normally with most machines, they use the strips to monitor your blood sugar, and as I said, the different machine is just on the strips. So the strips, the reagent used in making them is the different, and the best are those that have glucose dehydrogenase, meaning they can't react to the oxygen within your level. The oxygen within your body levels cannot give to regular sugar levels. So what you'll do, you'll just insert the strips, and in most machines you don't need to put them on. When you insert the strips, the machine will become on, and you see it's on, then it's beeping, then it will ask for blood now, meaning ready for injection. So some machines have pens for injection, okay, so that you remove the fear of injection, and they have needles that you use also. Now a good needle is one that is also as small as possible, so that it doesn't affect your your nerves in a way that doesn't induce much pain. So you'll just put it in, and normally like this one have ranges. So depending on the toughness of your skin. So if it's a child, you lose 1 unit, but if it's a bigger person, roughly at 3. So I will open my needle and then insert back my cover. So between this part there is a spring. So depending on how the spring pushes, they also make it equality. So then for injection, I'll just make it ready, it turns yellow, and I was to have a cotton, sorry I didn't carry it. So once I inject myself, it will remove blood, and I'll just put the blood here. So this one uses a very little blood, and in few seconds, I'm disclosing my sugar level is okay. In a few seconds, my sugar levels will be on.
It says what, 5.3?
Yes, 5.3. So the good thing with this machine, it can show you where your sugar level ranges. So if it's on the blue, it means it's high. If it is on the green, it means it's normal. If it is red, it means it's low. So it's showing my sugar levels is on green, so which is normal, which is between 4 to 8. Then the good thing also, you can easily dispose it, and there are the current one that has a button that you just remove and dispose. So I'll dispose it as well here, and that is your sugar level. So some of them can store the reading, you don't need to write them. And then averagely, when you go to your doctor, you just use an application, and then it will show your sugar levels, and can even do Hb1c. Some of them can do ketone. You know, yes, ketone is ketoacidosis. When high blood sugars are high, the body uses fat for energy instead of carbohydrate. Then what happens is they remove waste in form of ketones that can lead to diabetes, ketoacidosis, or affect your kidneys. All right. Well, I tell you what, so much information. I want to say thank you so much. Where you be found online, physically as well, for people who still have many questions? Yes. So online, I work at Mata Hostel. So we have a main branch at South B. You just make a call through the Mata website. And I also go to Buruburu Clinic and Shujamal Clinic. Among our other clinics that we have in Westlands, we have a nutritionist who is also a diabetic educator. In Town Development House, we have a nutritionist who is a diabetic educator. In TRMM, we have a nutritionist. In Jewel, in Karen, we have a nutritionist. Also in Buruburu, we have a nutritionist. And also in Thika, we have a nutritionist. So you can get me through Mata website. You just call them. You tell them I need Felix nutritionist, and we'll be able to guide you. And remember, diabetes diet plan is not nowadays more of the half a plate vegetables, a quarter starch, a quarter protein. That is a layman's understanding. So we'll teach you depending on the sugar units that are within your cells and the carbohydrate content that you require during the day, and plan your diet and monitor you daily for a period of 2 weeks depending on your sugar level, so that we adjust your diet plan. All right. Yes. Well, I'd like to say a big thank you so much. Make sure you can check the website or look for us for Felix Nutritionist at Mata, and ukipotea sana unaweza nitakuhook up hapo hivyo. But thank you so much. I hope I know there's still some questions, but I hope that we'll be able to answer some of them, and you've learned a few things about this and managing it and living with it, and just again watching your diet. And we'd like to say thank you so much. Continue. We'll see you again right here tomorrow, where we'll be eating healthy. We'll be eating healthy on our cooking segment as well. So thank you so much. Stay with us. Later on, at the top of the hour, of course, 7 a Citizen is going to come through. But thank you so much for watching. It's accessible to look like you, and like you saw yesterday, even with Ole Gunnar Solskjaer gone, the great Manchester United. Mungu awabariki sana.